I'd like to first off thank the Edmonton Zone Medical Staff Association for this incredible award. It does mean a lot to me and really to the whole team that stands behind me, who I'm representing today getting this award. The award that I'm receiving today for innovation describes a little bit a journey that we took at the beginning of COVID, where in an attempt to make anesthesia and surgery safer for our patients, but also for the healthcare practitioners who provided the care, we went on a tangent trying to figure out if there was a way we could do breast conserving surgery or generally breast cancer surgery without using general anesthesia. Knowing also that one of the big issues around general anesthesia is the intubation, which we consider an aerosol generalizing medical procedure, and this is thought and explained to be more unsafe in the risk of transmission of the coronavirus or any virus in general. So we discussed the pros and the cons, and primarily we're concerned about finding something that was at least as safe as general anesthesia and ideally non-inferior to general anesthesia. And it was a few physicians and myself, a few surgeons and myself, who came up with the idea that yes, we could probably try this if the patients were unconscious, meaning they were sleeping, they were comfortable, but not to the depth that they would require any manipulation of their airway. And at the same time, the surgeon could provide complete coverage of the pain of surgery with local anesthesia injection prior to cutting. Then we thought we had a very good chance of doing this. And so we first started with smaller breast cancers, more peripheral ones. And very quickly we realized that we were onto something and that we found a method which was not only equivalent, but actually superior to general anesthesia that the patients had received before. And in short order, we established a working group in between 6 different surgeons and myself who learned together and embarked on the journey together to find a way to make surgery better for patients who were faced with breast cancer and needed a segmental or a partial resection or even a full resection of their breast. And in this line, I would maybe like to jump to the end where we are today. We have established a program that has served over 600, probably even over 700 or 800 patients in this capacity who have experienced surgery without general anesthesia, who have had far superior outcomes in terms of pain control, nausea and vomiting, surgical stay, but also the efficiency has gone up tremendously. We have, compared to numbers prior to COVID, achieved an increased surgical output of around 170% purely for breast cancer patients, even around 280% compared to where we were before COVID. So my thanks go out to my entire team, to the doctors Niku Rajaim, to Dr. David Olson, to Dr. Lashan Paris, Dr. Wally Yakimetz, to Dr. David Lesniak, to Dr. Mary Stevens, to Dr. Cam Fathamani for their continued support in and around the whole project we've done. It goes to my anesthesia colleagues, Drs. Hogan and Bittencourt, and to Dr. Baithun, who, along with Dr. Dersey, have primarily embraced this new method of anesthesia and have brought it to where it is today. And of course, we could not do this at all without our wonderful colleagues from nursing. Dana DeVerden, our chief nurse at the Cross Cancer, has been instrumental, as well as all of our OR nurses, and especially singling out our recovery nurse, Deb Freeman. Thank you to all. I really appreciate your help, and I look forward to continue this journey together.